I don't think so. I think I'm a realist, and you don't mind me going down those same pathways then, do
Oh
you?
no, I feel like people like us, we're like, if you see the comet in the sky, our job is to tell the people there's a comet coming. Now, some people say, "Oh, you're being pessimistic." I'm like, I'm not being pessimistic. I'm telling you there's a comet in the sky. And me telling you there's a comet in the sky coming for us is me being a pragmatist. Now, the way I respond to that, it shows whether or not I'm a cynic or I'm hopeful. I believe I'm hopeful like you, Mark. I say, now that there's a comet coming in the sky, how do I destroy the comet? And you caught me in mid conversation with Dr. MarkAlain Déry from the great state of Louisiana. He is fantastic. He's an infectious disease physician, also a super progressive community activist, a co founder of a fantastic radio program, 102.3 FM, a radio dedicated to human rights and social justice. He invited me, Sam Cedar, Dave Sirota, and a few others
Tom
last year.
Hartman and Tom
Yeah,
Hartman.
and Tom Hartman last year to New Orleans, hosted us right there, fed us tasty cheese and hummus. He's a man who uses his expertise and his medical background to save lives, but also to promote social justice. And I literally have him on because you all saw that batshit crazy. I mean, we have to call it for what it is. I mean, RFK Jr. is the director of Health and Human Services. And then yesterday, the same mother effers who voted for him, like Bill Cassidy, a doctor, grilled him with gotchas. Mother effer, why did you appoint him? But I digress. And we're seeing measles skyrocket. We're seeing an attack on vaccines. So I thought, why not bring an infectious disease expert, a physician who deals with us to talk about how MAGA is making diseases great again? And the comment that we were talking about is the comment that Mark Elaine, Dr. Derry, wanted to warn us about. I yield the floor to you, sir.
So thank you so much. And by the way, Bill Cassidy's my senator here in Louisiana, and was the champion. I mean, he was a hepatologist at Charity Hospital, and in the '90s, if you were a liver doctor, you were just dealing with hepatitis C, mostly IV drug transmission, and so there was a level of compassion. He had a temper. The word on the street is, but he was a compassionate person, and I do believe that to a certain degree he is, and he unfortunately just kind of sold out to the politics of the time. Anyway, that being said, Wash, thank you so much for having me on. And there's just so much to talk about. I think probably looking at it from a 40,000 foot, and then we could just kind of go more
Yeah,
detailed as
please.
the discussion progresses, is that we are seeing a complete dismantling of the public health system, full stop, period. If you were doing something if you look at the public health system, and by the way, you could look at the finance system, you can look at the banking system, you can look at the education system, you can look at the housing, whatever way you want to look at it.
Mark, we just talked to Justin Wolfer, is the economist from Michigan, who was talking about the destruction of the economic infrastructure. And he said exactly what you said. They're destroying the institutions. And I told him you were coming on. He goes, I got to hear that.
Yeah, I mean, so if you look at them as Jenga, that's why I'm kind of doing this. If you look at them as Jenga games, right? At the Derry household, Wise, I don't know if you remember, we have a big Jenga
I
kit
remember.
that we play regularly. We enjoy playing Jenga because it's just for my wife and I, it's how we decompress at the end of the night. But once you start pulling out critical pieces of a Jenga set, like when the large sets that we play with, we know what's going to happen. I know when it's going to topple over because you start pulling out the critical pieces. And what we are seeing right now is the absolute equivalent of dismantling a Jenga system, a Jenga game, when you are just pulling out those foundational elements. And why are we doing this? Why are we seeing this? We are seeing this because I believe, and I think that if I am, as we were just mentioning a moment ago off air, we're pragmatists. I'm a scientist, full stop. That's who I am. I am a scientist. And when I look at things, I'm able to put trends and patterns together. That's what I do as a scientist, as an epidemiologist. I have a master's degree in biostatistics. That is what, logic logic is statistics. Statistics is logic. And when you look at things logically, we are seeing a dismantling of our society. We are seeing a societal collapse. And when you look at it even from a 60,000 foot perspective, why is society, why are we seeing our leaders trying to promote or accelerate a societal collapse? I think it's because they want to stay in power. They do not want to see a multicultural, diverse democracy. They don't want to see Black and brown people. They don't want to see LGBT. They don't want to see the promoting of minority populations, sexual minority populations, what have you, at a seat at an equal level as white cisgendered men. Quite frankly, that's what it comes down to. And I believe that where we are right now, and from my perspective, from a public health perspective, from my perspective as an infectious disease doctor, they are going to be promoting something that Naomi Klein terms viral collapse. And viral collapse is this notion of, have you heard anything about bird flu lately? Remember in Biden, like, why are we not hearing anything about bird flu? Is it
Well,
because bird flu?
what I've heard is that Moderna, which was developing a vaccine and had $800 million to potentially combat bird flu, which has moved to human beings, this administration under RFK, the man with brainworms, said, "Nah, let's not waste money on that. Let's give $200 million to the White House ballroom and $250 million to a concentration camp with alligators in Florida." That's what I
that
heard.
they closed down. The reason why we're not hearing about bird flu is that I don't think it's because bird flu has gone away. I think it's that, and it may have. That's one hypothesis. I think more realistically is that we're not seeing the surveillance. We are not hearing about bird flu because the surveillance for bird flu has gone down. We're not hearing measles like we used to hear about. We know that measles is out there. I am scouring the literature regularly looking for stories about measles. We're not hearing about it. We are seeing a decrease in the surveillance of these things. And this is something that occurred at the CDC right from the get-go. They even like decreased the surveillance of Ebola. And just last night, I think the DRC, the Democratic Republic of Congo, has announced that there is a full Ebola outbreak happening, I think with 25 cases. And I think it has a 50%, at least this version of Ebola in the DRC, 50% mortality rate. So what we are seeing here is a willful ignoring, a willful turning away and stepping away from highly preventable illnesses, not only just vaccine preventable, but let's focus on bird flu. The fact that this bird flu virus, now a total of roughly 900 cases total over the course of 20 years or so since bird flu first came about. Bird flu is defined as H5N1. Those are the nomenclature of the proteins that stick off of the virus. If you think of it's a ball with little spikes sticking off of it, those are the proteins, H5N1. That has, at this point, has a 50% mortality rate, as we've seen across the globe. Across the globe. Now, if there is an H5N1 epidemic, that's likely, thank goodness, that viruses can't live as highly virulent. Virulent means pathogenic or deadly, or highly transmissible. They have to live one or the other. So think of COVID. COVID was highly transmissible, but had a low virulent. The mortality rate is 1.5, 2%. It was maybe a little higher at the beginning, but now it has a very low mortality rate. So highly transmissible, low mortality rate, right? H5N1 can go either way. It could have a high mortality rate and low transmission, but more likely it's going to be a high transmissibility, but a lower mortality. But what's lower from 50%? So that is very, very worrisome. Now, I'm not saying that that's happening, but certainly people like myself look at things like that, and it's cause for concern, really, quite frankly, especially since we're not paying attention to it. And it hits home because, Waj, we had there's, I think, maybe 2 deaths right now with the current U.S. outbreak of bird flu that has happened. And one of them happened in Louisiana. I'm in Southeast Louisiana in New Orleans, but in Southwest Louisiana, we don't know much about the case, despite my contacts in the state. They are tight-lipped about it. But essentially, it was some person, we don't know the sex of the individual, but they were in their backyard. They handled a dead bird, by the way. Please, for all your listeners and viewers, if you see a dead bird and you need to handle that dead bird, please use PPE, use gloves. please protect yourself because we don't know if that dead bird that you are handling may have died from bird flu. So please, if you have to handle dead birds, please do so by protecting yourself with gloves, with masks, if possible, with gowns if you have it. If not, at least with masks and gloves. And then please, dispose of it, just recognizing that that bird may have died of bird flu. So this person handled the dead bird without the PPE, whatever, ended up in the ICU, and of course died. Now, at this time, they were. And when I say of course, because they were a little bit older, we know that, and we know that they had multiple comorbidities. But here's the kicker. Watch. Here's the thing that's important: was that this happened during the Biden administration when the CDC was in the before times, right? When it was still the CDC. The CDC was at the bedside, and they were drawing blood regularly from this individual. And what they found was as they were plotting out what the virus was looking like from a genetic perspective,
Mm.
that the genes started to align themselves every couple hours. Every time the virus reproduced and reproduced and reproduced and reproduced, what they started to find was that the genes were aligning themselves closer and closer as to what a human bird flu virus would look like. And that was in one individual. One individual. So this is meant to be a warning that bird flu, and we have seen bird flu take off here in the US. We know about that, since before, during the Biden administration when, information was much more free flowing. We saw how it kind of decimated through chickens. This is why eggs got so expensive about 3 years ago during the COVID era, because they had to cull all the chickens. We've seen how it's gone through mammalian, large mammal populations as well. So it's a concern. And the fact that we've taken our eye off of it, I take you back to Naomi Klein's notion of viral collapse. It's this idea of not paying attention to viruses and then using viruses as a mechanism for societal collapse. And I'll yield the floor right back to you, Waj.
No, no, continue. This is
I
great.
just want to say that this is largely what we saw yesterday, really kind of provides fuel for this notion of a potential viral collapse. First of all, he spoke gibberish the entire time, and there was no logic, and don't even try to find logic in what he was saying. And we'll talk hopefully about the governor of Florida in a moment and talk
Yeah, yeah.
about gibberish, and the things that he was saying was appalling. But we'll get to that in a second, because what Florida is doing is, again, another version of this notion of viral collapse. But by making vaccines difficult, and the senators, and I'm no fan of the US Senate, right? But the senators were telling their personal stories of their family members or loved ones or people they know that have multiple comorbidities, that are trying to go to a pharmacy, that are trying to get COVID vaccines, and they're being denied. And RFK is just like, no, 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 that's not the case. When like reality, we've moved into this post-truth
Yep.
world where it doesn't matter what is being said anymore. And I promise you I'll end with this, because I think what
No,
you and
I
Danielle
keep going. I
what
follow it.
what you and Danielle said, I think yesterday, what I saw you guys say yesterday was so key, and it was so spot on, because I say the same thing, which is we have to start taking care of ourselves moving forward. We have to start taking care of our family members. We are the ones now. Like, listen, it was Katrina, right? Katrina just happened 20 years ago. No one in New Orleans wanted any of this remembrance of Katrina. We are happy letting that go. It was a very, very traumatic memory for us, and for us to have to go through a 20-year whatever, and it was on the news, and it was just like everybody in New Orleans was like, just please just make this go away. We don't want to deal with that sort of memory. But what we can take from Katrina, and for all of the listeners that are listening, I know that we grew up in a world where, America, we're number one. America is there. It's going to be there for you. We see how America responds to the rest of the world. But I just have you look at Katrina, and you saw how we were grossly ignored. You see that picture of Bush just kind of flying over New Orleans. And that is the quintessential picture of how the US is going to help us moving forward. It ain't going to be there. It's going to be incumbent upon us. So I implore you guys, please watch these podcasts. Watch, Waj and Danielle and all the people they have on their shows, because they are 100% correct. There's no one that's going to be there to take care of us except for us. And as long as we have this platform, as long as I have this platform, trust me, believe me, I will be up here, and I do this every day. I'm on doing, noise filter and a bunch of other stuff. But just please recognize that we need to advocate for ourselves, because right now the CDC is not anybody that we need to be listening to. Certainly RFK is nobody that we should be listening to. And I promise you one more thing, Waj. We are seeing that now, the West Coast, California, Oregon, Washington, Hawaii, and I anticipate there are going to be other states that are going to create their own version of the CDC. So they will be able to provide information publicly in a way that the CDC is not going to be able to do so moving forward. And I just read this morning that the state of Massachusetts, the governor signed a bill. I don't know if it's an executive order. It's probably an executive order, because I'm sure it didn't get through the machinations of how a law is made. But an executive order that was signed today by the governor of Massachusetts, that's making it so that if the state of Massachusetts health department recommends a vaccine, then the insurance companies have to pay for that vaccine. That state recommendations supersede the federal recommendations. And I think that that's how blue states are going to get through being able to pay for your COVID vaccine or your Shingrix or your flu vaccine or your RSV. So, Waj, sorry, I know that was just a lot. It's just
That
been
was
kind of
no,
burning
man.
inside of me, like.
You've been waiting to get that out, and for the people who are watching and tuning in, this is Dr. MarkAlain Déry. He's an infectious disease physician, a scientist. He deals with this every day. I just want to connect some dots, and I'm going to give it back to you, because we took the 3,000-foot view of and I'm so glad you mentioned it, the deliberate dismantling of our public healthcare infrastructure. The $13 billion attempt by MAGA to just completely hammer it out, the gutting of the CDC, the gutting of the NIH, the cutting of cancer research, led by both fraudsters, people who are grifting, and also incompetent cranks like RFK Jr., and you saw it yesterday, promoting these conspiracy theories, replacing qualified men and women who have spent their lives researching these diseases to keep us safe with other cranks. And I'm so glad you mentioned bird flu, because it's been on the back of my mind also, MarkAlain. I've been talking since I have an immunocompromised daughter. Maybe that's why I've been on this. But I remember I wrote this New York Times piece even before COVID, talking about vaccine hesitancy, because I read in 2019 that the World Health Organization said that vaccine hesitancy was a top 10 threat pre-COVID. Thanks to the right-wing disinformation, now it has increased. Vaccine levels among kids have gone down. RFK is anti-vaccine. We all knew he'd be anti-vaccine. He's also eugenicist, right? I've mentioned bird flu. It's been in the back of my head, because each time I talk about measles skyrocketing, very contagious. There's a measles epidemic now, folks. COVID's still around. I mentioned bird flu because I remember two data points. Number one, bird flu had jumped to humans, and it just stuck in my head because I'm a masochist. The other data point I remember is from the early summer, which was news that should have been bigger, that under RFK, Moderna, that was given $700 million to develop a bird flu vaccine, they took that $700 million out, folks. Things happen quickly, folks. Things happen quickly, right? COVID wasn't a thing until it was a thing. And speaking about the Katrina, and MarkAlain is in Louisiana right now, he has stories about Katrina. Speaking about the 33,000 or 30,000 foot level view of the dismantling of the U.S. Infrastructures, just last week, FEMA staffers warned that there was a potential Katrina level disaster, their words, that was about to happen thanks to this administration cutting disaster relief funding, and also, wait for it, there's a recurring theme, having incompetent people at the top. The acting FEMA director did not know, folks, that America has a hurricane season. So FEMA staffers, much like EPA staffers, much like CDC staffers, now are going public and warning. And folks, the Trump administration fired some of these FEMA people for complaining. They fired some of these EPA people. And what's happening at the CDC right now is that Dr. Monarez, who was appointed by Republicans, said, you know what? I'm not going to kill people. You're so batshit crazy. And he's trying to fire her, which is why people are resigning from the CDC. Just so everyone's up to speed now. Now, let's take it from another level. We talked about the government, but we're talking about how all of this is connected. Florida. You mentioned Florida. Folks, Florida. A state hasn't removed vaccine mandates for 45 years until now. Florida, and specifically Governor DeSantis and Surgeon General Dr. Joseph Lombardo, has said, you know what? Those vaccines that you and I take, Dr. MarkAlain, MMRs, measles, mumps, rubella, meh. Talk to us about Florida and the impact this will have on public health, because I don't think people are connecting the dots.
Well, first of all, well, I think I heard you mention it, but can you just real quickly just mention the offensiveness of what he was talking about when he gave his speech, the gibberish, like just, he equated vaccines to slavery. I
Oh, yeah.
mean, this was, again, this is gibberish. And while it's, I mean, right now I'm not in the mood to make fun of it because I'm passionate about this, but in my off times, yes, we make fun of it. We mock, we use satire, but this is deadly serious. I mean, what is going to happen is, in all respects, when I say deadly serious, those are words that are being chosen very specifically. And before I start, I also wanted to say this. Waj, I know you're the father of like 2,400 kids.
Yes.
So would you take them to Florida now to go to Disneyland or Disney World?
Man, listen, I'm glad you asked that. My in-laws are in Florida, and we've gone to Florida. We go to Florida like twice a year. Um, and my in-laws are seniors. There are a lot of elders who live in Florida, and I know that seniors, they become compromised. I know a lot of people, a lot of Republicans or elders retire in Florida. So if you have kids who aren't vaccinated, that means those diseases can spread. And I have an immunosuppressed daughter. Um, I am very, very uncomfortable going to Florida. And another thing I'll add, going off of my conversation with Justin Walfer, is the economist professor, Florida is also the hub of Disney and theme parks. So tourists come to Florida. And
Not anymore.
connecting the dots, I remember a couple of months ago, Dr. Mark Elaine, and I'm sure you could tell people that Mexico sent an advisory warning for people in Mexico not to go to Texas once measles skyrocketed. So now, if there's no MMR vaccines for kids and measles is highly contagious, can you tell us what's going to happen?
Was Yeah, well, yes, 100%. And also, let me just say, let me predict way in the future, because this is something that you guys have been talking about, that I've been talking about as well. There is going to be a time where we are going to, for people, and thankfully, I work very hard. I have a very good job, and it provides me some financial security that I would be able to take myself and my family to go to Scotland, to go to France, or to go to Portugal or Mexico to get a bird flu vaccine, to get a COVID vaccine, to get the vaccines that we are not, and believe me, like, one of the things that I do is I utilize my privilege that I'm very, very aware of, to on platforms like this, to share, to advocate for those that don't have the same privilege I do. I recognize that I will be able to get myself and my family vaccinated, but I also recognize that not everybody will. And to me, this is not the country that I grew up in. I mean, it was a very flawed country to start with. And now I often talk about being in the dark ages, but in the dark ages, they didn't know they were in the dark ages. So I refer to this as the dark ages, because we know we are purposely stepping backwards. So just to be very clear, the vaccines that kids take at young ages are MMR. I'm not a pediatrician, so I'm doing this off the top of my head. So, are MMR, measles, mumps, rubella. Just to remind everybody, measles is single-handedly the most infectious virus. For a minute during the COVID epidemic, COVID almost was reaching the measles level of transmissibility. It has since gone down, but the measles, and also measles is not benign. For some kids, it can be benign, but it also can lead to very long-term, very serious issues like blindness, deafness, and subacute sclerosing encephalitis, where one day, about 10 years after you've recovered from your measles, so as a child, let's say you got it at 1, maybe you're at 11, all of a sudden your school functioning starts to become very poor. You start to develop significant tremors and seizures, and then it has a 100% mortality rate. Then you die. I mean, it is a tragic, tragic, tragic complication. It's rare. We will see in 10 years with this epidemic that we are seeing currently, we will see what the actual rate of subacute sclerosing encephalitis is in about 10 years once we see how many kids had it here, had measles, and then who went on to develop it. But we are going to see recurrences of MMR. We're going to see recurrences of polio because we see how easy polio virus is transmitted. We are going to see kids are not going to be protected for Tdap, which is tetanus, diphtheria, and pertussis, which are still persistent. We are seeing a pertussis outbreak. We are seeing one currently in Louisiana. In fact, there's been a persistent pertussis outbreak since I've been here in Louisiana, which has been 20 years. We're seeing more of it around the country as well. And tetanus, without a tetanus vaccine, a kid steps on a nail in the playground and they could then develop tetanus. And that is a whole other complications. One of the things that I tell doctors, and I lecture regularly, and in fact, one of the things I'm going to be lecturing on in the next couple weeks, Waj, is something you'd be interested in. I'm lecturing to a large conference of 1,000 physicians on how to manage pandemics in the setting of limited government resources.
Mm.
And basically, the organizers called me up and said, "Just give us like a 2 or 3. How are you feeling about this? What is going to be your general message?" I'm like, "Oh, the general message is going to be we're effed."
Yeah.
And one of the things that I am trying to do is I'm trying to get a lot of my colleagues to go through the 5 phases of grief now. You
Wow.
have to go through them right now.
Wow.
Now, if I could do this off the top of my head, I think it's denial, anger, maybe depression, bargaining, and acceptance. I think that's what it is. Okay. Denial, never. I never denied it. I saw this coming way, way, way down the line. Bargaining, never. Acceptance,
Anger.
never.
Anger is the second one.
So what am I left with? I'm left with anger and depression. And I
Mm.
vacillate between anger and depression before I could get to acceptance. And what that really means is that what my message is going to be toward my colleagues and what my message is to your viewers and to you is we have to go through these 5 stages of grief now, which is really anger and depression for most everybody that I know. Because once we get through that anger and depression, we are going to be there front and center for our family members, for our community, for my patients, for the public health. Because once we start, I'm going to tell you, I've done a lot of work abroad. Watch, I think you know this. I've done a lot of work in Ebola, Ukraine. I've been in
Katrina.
Haiti a number of times. Katrina. I was in Haiti after the earthquake. I've been to Haiti a dozen times since then. I'm probably one of the only physicians in the US that's actually seen and taken care of people with measles. Let me tell you the most tragic thing you've ever seen, Waj, and I don't mean to get dark here, but the death of a child is tragic. The death of a child from a vaccine preventable illness is the most tragic thing you'll ever see. And I saw that in Haiti after the earthquake. I saw lots of cases of tetanus. At the time, what was the movie about the purple people and whatever some big movie in 2010 that was out. I can never remember the name of it, but it cost like $900 million to make. At that time, it was the most expensive movie to make. And Hollywood is making the most expensive movie in the world while, in Haiti in 2010, you had people dying of diseases that could be prevented with a 25-cent vaccine. So these are the sorts of things that we're going to start seeing. Add on top of that, like you said, we're going to start seeing elderly individuals suffering, and one of the things that I tell physicians and young physicians, I obviously teach and I'm a mentor, and I go to medical schools around the country to lecture, is that the upcoming physicians, those that are training right now, are going to be the first generation of doctors that are going to have it worse
Mm.
than their predecessors. Every year, there's so much medical advancement. I went to medical school in the 90s. I've been in practice for 27 years, Waj. I've seen every year significant advancements that have happened over and over again since I've been a doctor. Those advancements are going to be gone. And it's getting these young physicians ready to deal with things that we used to deal with 100 years ago. It's going to be the first generation of physicians in the history of this country, no doubt about it, and possibly right now in the world, where we are going to be taking huge medical steps backwards, and they're going to have to be learning things that we haven't learned about, using skills that we haven't had to think about, because one, the technologies aren't going to be there, and not only that, but they're also not going to be protected. Certainly the populations aren't going to be protected from these viruses and potential bacteria. So, long-winded answer as to what's going to happen in Florida. What they are doing in Florida is going to kill people. And I
Yep.
think one of the
Yep.
things that we need to recognize is that we are seeing the active dismantling of the public health system and the healthcare system. One of the things that we're going to have to recognize, besides advocating for ourselves, is that we need to ready ourselves for the massive changes that are going to come down the way, that things aren't going to be as they used to be. And it's not going to be that, I don't even think it's ever going to become that way, but we are generations. And if you define a generation as 20 years or so, we are 3 or 4 generations from possibly ever getting back to normal. To
It's I'm
paraphrase,
so glad you mentioned that because I've mentioned it. I've kept saying it. I know you watch generational damage, and people think I'm being hyperbolic. Can you just go step by step from the healthcare perspective, the type of generational damage that has already been done in the first 8 months of the Trump administration?
I mean, first of all, I'm an international physician, so what it was done with USAID is probably the easiest place to start looking, because and I don't have the numbers off the top of my head, and I should have,
Three hundred
because
thousand people killed.
I've reported on this. Yeah, there's been a number of deaths. I mean, first of all, I'm an HIV doctor, so this is emotional for me, Waj. And to see, I'm an HIV doctor. My father was an HIV doctor. He was one of the first, if not the first, HIV doctor in Los Angeles. HIV is near and dear to my heart, and we have seen incredible advancements in HIV care. I mean, I can't tell you, you don't see HIV in the news anymore because there's no reason. It's one pill once a day, and people live long lives. They live the lives of somebody who doesn't have HIV. Their U equals U. That means undetectable equals untransmittable. People who are living with HIV who have undetectable viral loads that we can test in the clinic. They don't transmit HIV to their intimate partners, so they can have condomless sex with their intimate partner or partners and not transmit HIV to them. So for somebody living with HIV, that is the most peaceful thing. I mean, imagine having the most intimate moments with the person that you love, and in the back of your head, you may think that you could transmit a deadly virus. That's how it was before. But now we know with solid scientific evidence that people living with HIV can have condomless sex with their intimate partners and know in their hearts of hearts that they will never transmit that virus to somebody. Okay, so that's where we are with HIV right now. Huge, and I'm an atheist, but huge miracles, right? I use that word very specifically. Huge miracles with that. But what we are seeing in South Africa is horrific. We are already seeing numbers of deaths. We're seeing clinics who had to shut down almost immediately. We are seeing the projections of deaths, I think, were 250,000 people. I think
Yep.
maybe you said
Yep.
300,000.
Yep.
And here's the kicker, and I'm sure you're aware of that. A third of those deaths, so let's say 300,000, a third of those deaths are going to be children. This
Yep.
was something, again, as a human species, caring for the most vulnerable should be what defines us as being a good and humane and ethical a species. And being able to care for children living with HIV should be paramount amongst those things that we do. And that has been completely wiped away. That's the first of many things, Waj, that generationally speaking, we are going to see a rapid uptick of HIV transmission throughout in South Africa. The reason why South Africa, just real quick, is that the virus in South Africa is different. It's HIV, but just think about, like, imagine going into an ice cream store. You have multiple flavors of an ice cream. It's all ice cream, but there's multiple flavors of it, right? With HIV, that virus happens to be very transmissible, specifically amongst heterosexual people. The one that we have here in the US, which is very much like the one that emerged out of Haiti, actually, and there's a reason for that. It's a really fascinating story. But that is mostly amongst men who have sex with men. The virus is particularly prolific amongst heterosexual couples in South Africa because it transmits very easily. This is why we see so much action when it comes to HIV in South Africa. But when you look at
So that
the
means it spread. I mean, it'll spread if we live in a globalized world.
significantly, because again, once people are off their medications, it's going to be a while before, I don't mean to be doom and gloom, but it's going to be a while, several years before they ultimately, pass on as a result of end stage HIV, which we used to refer to as AIDS. But in the interim, these are individuals that are human beings, and they're going to likely engage in sexual intercourse or sexual intimacy. And when they do, there's a high risk for transmission. Yes. And so we are, again, that is another destabilizing force. But it's not just that, it's TB. It's malaria. These are all things that internationally that USAID was doing. And now I just read an article last week that they're having garage sales. They're pawning off the computers and the tablets and and the things, in a local community, whatever USAID had, they're just literally just pawning it like it's a garage sale. It's really shameful. When you look at what's happening here locally, we are seeing the destabilization. They got rid of like the drowning unit, the violence unit at the CDC. They've gotten rid of a lot of these preventative entities so that because the CDC wasn't just about infectious diseases. It started off as that, Centers for Disease Control, but then they added the and prevention. But we just say CDC, we don't say CDCP. And prevention was really critical because that's how they started, extending into gun violence or diabetes or hypertension or drowning prevention or suicide. One of the things that we now know as well is that they've gotten rid of the LGBT section on the suicide hotline. So the people who are most at risk for committing suicide, we know are LGBT youth, have highest risk of suicide, and the element that was there for prevention has been removed from them. So when we talk about generations, we're talking there's going to be if there it's hard to even project into the future, but it's going to be decades. It's going to be generations. I think 3 or 4. So we're talking 60 to 80 years. And really, I see the work that I do is just really planting seeds for trees to grow, for whose shade I'm never going to actually sit in. And this is the thing that is the most, critical thing, is that we need to work hard for the future, just like the people in the future who may have worked hard for us. We need to recognize that moving forward. But right now, we're at a time where we are actively witnessing the dismantling of the public health system. And it's imperative for all of us to go through the stages of grieving now. I need everybody listening to get through that anger, to get through that depression, so that you are there finally. And we'll never accept it, not an acceptance like I wanted this to happen, but like Kubler-Ross said, it's an acceptance of the situation that you're in. And once you're in that situation, you are going to be able to respond appropriately. And I think that's the situation that we're in right now, Waj.
No, I appreciate your honesty. A couple of days ago, I'm sure you saw the conversation. I had Dr. Kavita Patel on, and Dr. Kavita Patel said, "I've never said this before. I'll say it publicly. People shouldn't come to the United States of America." And she said, much like what you said, because she's on the front line. She's an internist. She's a professor at Stanford. She said they're dismantling the public healthcare system. It's generational damage. And the advice that she gave was: imagine you're on a plane, and the attendant says, "Put your mask on first before you take care of anyone else." And she was saying this: you can't rely on the healthcare institution in America anymore. You just can't, because it's been run by these cranks who are replacing all these experts. And she knows Dr. Moneris, right? And she says the fact that you can't trust our institutions, well, the question then becomes, who can you trust? And she then gave some resources, and she said the front line of defense is your pediatrician, your family health doctor. My wife is a family health doctor. Repeats a lot of what you're saying, is that this is disastrous. And I think when people listen to us, they might say we're doom and gloom, we're cynics. No. For those who caught us while we were in mid-conversation and we went live, the analogy that I gave and that Dr. MarkAlain Déry, thank you to the 900 people who are watching, infectious disease expert, is that if you see a comet in the sky, our job, and I think you agree with me, MarkAlain, is we have to tell people there's a comet coming because we want to save lives. Now, the second step is, do you just give up? Do you sit there and be like, there's a comet coming, whatever? Or do you do everything within your power to save as many lives as you can and dislodge the comet, right? So that's what we're trying to do. We're trying to warn everyone. I've been saying, for anyone who's been watching the Left Hook for a year, that of the Trump's four horsemen of the apocalypse, right? If you want to put Kexet there and you want to put Rubio there or Vance, you want to put another one, Tulsi Gabbard, I said the most dangerous one to me was RFK. Because if RFK was going to be the director of Health and Human Services, the reason why we don't talk about the Health and Human Services folks is you never had to. It was not politicized. Didn't matter if it was Democrat or Republican. That's why people never care. People don't know about National Institute of Health. I'm sure there's some smart people there. CDC. I'm sure there's people trying to keep us safe. We never had to worry about this. And then I've been following RFK. I know his conspiracy theories. I know his eugenics background. I know the racism, and the fact that he came in and did everything that he promised he would do. The question I have for you, and maybe you know this better than I do from a medical and political point of view, is the end game. I've talked about the eugenics. I've talked about the white Christian nationalism. He believes in something called herd immunity. He believes that, this will be better for people. He believes the bullshit that vaccines cause autism, all bullshit, debunked, and Dr. Kavitha debunked it. But the end game, the Republicans around him, surely people like Bill Cassidy, Mark Elaine, they could see mass death. What is their end game? This doctor in Florida, he's not stupid. He's well trained. Like, he knows if his family is there, they're going to die. This is why I've always called it a pro-death movement. What do they hope to gain? And or do they believe RFK?
No, but RFK. So one is I knew they were gonna put a ghoul in there. The reason why I actually was rooting for RFK to be put in there, to be perfectly honest with you, was because I knew that if they had put somebody who was silent in there who could do the job effectively, but without raising any without raising any cackles or kind of ruffling feathers, that it would happen. The dismantling would happen silently. So I
So
was actually kind of
a
secretly.
competent psychopath. You were worried of the competent psychopath.
Exactly. I wanted RFK to be there because I knew that just because of who he is, he would draw attention to the work and the dismantling that he was doing. But to answer your question, I think what it comes down to is and remind me of the San Francisco journalist who does the Nerd Right,
Gil Durant.
um Gil Durant. I think it's, and then the guy Mencius Moldbug. Who's the Mencius Moldbug?
Curtis
The
Yarvin.
Curtis. I think it comes down to that. To be perfectly honest with you, I think that Gil Durant, like when he talks, it's just like what he says is so spot on that I think that they're trying to work toward a network state. I really do believe that they're trying to get these network states happening. That they want to see a
Humane
societal.
genocide, Dr. Mark Elaine. That's what Curtis Yarvin calls it. Humane genocide. The humane
Yes.
alternative, excuse me, the exact quote is humane alternative to genocide. And the names that we just mentioned, Gil Durant, who has been on the show, just came on last week. Curtis Yarvin is the theorist that Peter Thiel has funded. J.D. Vance follows him, who believes in techno-fascism and says that capitalism is incompatible with democracy and wants a sovereign that is chosen by the tech bros. And he believes in a eugenics, just like Elon Musk does, just like RFK does. And he believes there are some non-productive people and that they should be transformed into biofuel and or live in a permanent virtual reality mindset where we just put them in a prison. And he says he's trying to discover humane alternatives to genocide. For those who don't know, continue.
I think that when you and this is how we started the conversation coming full circle, is that when you look to see all the things that they're doing, and one of the things I said was we talked about this notion of viral collapse, what Naomi Klein refers to as viral collapse, is that we are seeing accelerants towards societal collapse. And the societal collapse, I think, is going to assist significantly to getting us into this network state. So let's say I'm going to just make up numbers. Let's say one third of the U.S. dies from famine, from hunger, and from bird flu. You mixed in with some other new thing, or Ebola, whatever it is. That there's a destabilization of society, and then all of a sudden you're going to start getting folks that are going to then be like, "Oh, come to this network state, everybody's vaccinated," or "Don't come to this network state, nobody's vaccinated." Whatever the case is, and I don't see that in my head as clearly because that's not what I think about. But what I do think about is I think Gil Durant is right. I think that the Mensis Moldbug, Curtis Yarvin, I think that what they're trying to do and largely what we are seeing and it's largely I agree with everything that you've been saying too, Waj, is that, if indeed they are thinking that the president could be sick and may not finish this term or whatever, they move in JD Vance. JD Vance is just a progeny of Peter Thiel, and Peter Thiel kind of his in-house philosopher is Curtis Yarvin. I think everything that Gil Durant has been saying, I think he really does have a finger on the pulse of what's happening. I think all that may be happening, but this is the way. This is one of several ways they're going to get there. They're going to get there by financial collapse or by banking collapse, or what the professor from the University of Michigan was saying, some sort of using economics and the economic system for collapse. We saw the job numbers today were horrible today, right?
Yep.
Just like they were last month. They're not going to get any better. We know this whole idea of tariffs and what have you. It's a horrible idea. We know that this is a bad idea, but they're still doing it anyway. Why is that? I think that there is this movement to getting towards some sort of network state, and the dismantling of the public health system is one of several ways that they're getting us there.
I agree with you. Stuff that we've been warning about. I just talked to Gil a couple of days ago. Folks, it's on the left hook. I think it was just this week. And then I talked to Nafiz Ahmed, who wrote a book called The Alt-Right. He talks about it and he did a
He
deep
was
dive.
great. He
Yeah,
was
he,
great. He was great.
he did a deep dive into Curtis Yarvin. So I strongly recommend listening to those two because this sounds bullshit and crazy. We're not cranks. We're not conspiracy theorists. I tell everyone to believe the evidence of their eyes and the ears. It's all out there, and I agree with you. MarkAlain, I agree with you. They're looking for a collapse, and I've recently, as of this week, to just kind of drive the point home to people to make it make sense because it's so much. It's like corporate raiders, hedge funds who see a company that's hemorrhaging and they say, okay, yeah, we'll help you. Like, just look at Toys R Us. Look at private equity fund Toys R Us if you have 5 minutes. They come in, they're like, oh, we'll help you, Toys R Us. They don't help Toys R Us. They're like parasites. They come in, they hollow it out, they just leverage it with debt. Toys R Us collapses. Their shareholders get more money. The husk is then gone, right? It's a parasite. It just comes in, it sucks it all up. It's like I've been using that there will be blood analogy all day. The straw that comes in, and Daniel Day-Lewis says, I drink your milkshake. And all these people are drinking our milkshake. They're getting richer. All of us are getting poorer. They've invested in crypto. They want the dollar to be devalued. They've openly said it. They want the dollar to be devalued so that crypto, which they all have, becomes the predominant currency. People will be dumber. People will be more tired. People will be more sick. People will be more desperate. What happens when people do that? They do violent criminal stuff. Guess what we have in America? We don't have schools, but we have more private prisons and detention centers thanks to the big beautiful bill. And folks, the one stock that skyrocketed on election night when Trump was announced the winner was private prisons. So if you think we're crazy, just look at the evidence of your eyes and ears. Dr. MarkAlain, I appreciate your sober analysis. I know it's tough for people to hear. I appreciate Dr. Kavita saying it. People need to hear this. Again, the comment. And then you also mentions an analogy that I give. You don't have kids, but I have kids. You got cats. Uh, we're hopeful. We plant the seed for a shade that we will never feel. We plant the seed for a fruit that we will never taste. That's why I do what I do, folks, at this stage of my life. I'm being honest. I'm 44 years old. I got 3 kids. I've lived a good life. I'm eyes wide open. I don't know if I'm going to see the turnaround in America. I hope it happens. I hope we can see it. But I'm realistic. I might not. But my kids deserve better. What can people do and what should people do immediately to take care of themselves and their family's health?
So that's a great question, and I appreciate it. I think right now, and I've been kind of watching some of the comments as they go by. There's been several of them that have been like, "Go and get your updated vaccines now." I can't stress upon you to do that. Please go and get your vaccines now, whatever it is that you can get. I recommend COVID. I also recommend, obviously, the influenza and whatever you need. Please go get them now. If you do, I know the idea of people having doctors, whatever. If you don't have doctors, there are FQHCs, federally qualified healthcare clinics. They usually have sliding scales. They're meant for people who are Medicaid or who have either no income, or they're in that in between where they can't afford Medicaid, but they can't have private insurance. FQHCs are for you. Please look up a local FQHC. Please go there and please get vaccinated. They are waiting. They know what's happening. I belong to an FQHC. I've been talking to our CEO regularly. We have long conversations about this. We are waiting for people like yourselves to please come and get updated with your vaccines. The next thing is get the people around you to be vaccinated right away. Go and get all your vaccines. Tell them about the FQHCs. Tell them they can get seen by a doctor or by a nurse practitioner with sliding scale. The vaccines may cost a little bit money right now, but it's important for you to do so. If you can talk to people who are vaccine deniers and you think you could change your mind, go ahead. But to be honest with you, I've pieced out on those guys long ago. Like
Mm.
I don't even, if you're a vaccine denier, that's fine. I work at the hospital. I'm 60 to 80 hours a week in a hospital. If I recommend vaccines and they say no, doc, I'm like, I don't even go into it anymore because it doesn't even matter to me. And the last thing I will say is continue to watch programs like this, continue to watch program like Danielle Moody. These are the true tellers that I have seen, that I have found. I met Dr. Derry both here at Blue Sky at Blue Sky and here on Substack, and I'll start kind of increasing my Substack profile as
No, you
well.
have to, and come back anytime. I've been trying. I try my best. We're one man shops, but from the economics angle, I bring in Justin once a month, and then I hope you can join me. I've been trying to
Yes,
get
I
Kavita on forever, and Kavita finally, she was so busy, she came on. So if you and Kavita can come on as my doctor experts, because
mhm.
there's different angles. There's national security angles. I brought in Olivia Troy and others. There's governmental angles. There's civil liberties. I think people need to be informed of this societal collapse that is the deliberate strategy of white Christian nationalists, the bro oligarchy, and people like RFK. Healthcare, civil rights, the economy, right? It's all connected, folks. And there's about 1,000 people watching. I've been talking to Dr. MarkAlain Déry. He's a superstar, folks. If you're in New Orleans, him and his wife are just rock stars. I don't know when he sleeps. He's a scientist, a doctor, infectious disease expert. He's also started co-founder of a radio program. His
Radio
his wife,
station, radio
radio
station.
station. His wife, by the way, the better half, the wife is the engine
Yes,
behind it. But
she
she loves
is.
him. She goes, he gets these crazy ideas. I'm the one that implements them. They invited me last year. It's a fantastic community. So he does all this. This is his life's work. And for those who joined us late, 1,000 folks, it'll be up on my Substack and Dr. MarkAlain Déry's Substack, which we'll promote shamelessly later today, where I'd really strongly recommend listening to it. We'll have the transcripts. Uh, it seems like a sobering conversation, but you got to get through it. You have to accept it. You have to accept it. You can have the anger, you can have the frustration, but you have to accept what's happening. Eyes wide open, folks. Be woke. Look at the evidence of your eyes and ear, the dismantling of our healthcare system. What's going to happen? And then how do you keep yourself safe? And I really appreciate Dr. MarkAlain talking to us about how to keep ourselves safe. I will tell people, folks, it ain't just COVID. Uh, you sent me a correction. Tell them about Gardasil.
Right. Gardasil is an incredible vaccine. For those of you who are, I think that they've increased the age now to maybe 30, but it was like 22. This is a vaccine. It's a three course vaccine, 3 steps rather. And it's for boys and girls. Usually they start around 10 to 12. It prevents not only cervical cancer, so this vaccine, and it's almost 100% efficacy. In fact, ACOG, the American College of OBGYNs, actually have to change change the what used to be annual checkups for women in terms of pelvic exams have been changed now for women who have been vaccinated with Gardasil. But not only does it protect women from obtaining cervical cancer, it also prevents men, especially men who have sex with men. So, one, boys need to be vaccinated for Gardasil because they don't transmit it to their future intimate partners, be it men or women, whoever they are intimate with. But also importantly, if they are a man who has sex with men, that they prevent rectal carcinoma as well. So Gardasil prevents cancer in men.
I had no
It,
idea.
yeah,
You told me yesterday. No clue. I
yeah,
mean, I was
for
like, wow. I kept saying women, right? Because my wife kept saying this is like a game changer to save women who used to get
100%.
cervical cancer. And I think it's also it's HPV, right? Uh,
HPV, HPV.
yeah. So the fact that it also so get as many of your vaccine, folks. Okay, I keep hearing this, Dr. MarkAlain, and I hope people can stop saying this out. It won't happen here. It can't happen here. It's happening. It's happening. They're trying to literally. They've already put restrictions on COVID. Truth and freedom and free speech and don't tread on me. People are saying no, only if you're 65 years and older, and only in rare cases can you get COVID. I'm like, shut up, bro. Let me get the vaccine. If you want to be a vaccine denier, you go and die. But they don't care. They want to promote death on us. So if they're doing that to COVID and they killed the Moderna vaccine that they were developing for bird flu, and they're telling you kids in Florida, you don't need to take the MMR vaccine. Don't take any vaccine for granted. Listen to MarkAlain, right? He's an infectious disease expert, gone all over the world. Get your vaccines. Get your vaccines now, like yesterday, tomorrow. Go get those vaccines. Please, if you haven't been up to date, please, I beg you, your kids, and especially anyone in your family who's immunosuppressed, especially your elders, folks, make sure they're up to date. Lincoln Square is here. Thanks, Lincoln Square, for joining us. And Lincoln Square is here promoting the fact that I'm going to be on at 5 p.m. because who needs rest with Stuart Stevens. And Stuart has a former Republican operative advisor, never Trumper, and has spent years now trying to warn people against Trump. Has a great article out in Zateo. Came out, I think, 2 days ago. Really strongly recommend people reading that article where he goes step by step, MarkAlain, and gives fantastic suggestions for Democrats. Like, what the F are you doing? Do this now. I read it. I thought it was a great piece. I messaged Stuart. So Stuart's going to come out at 5. I was going to have David Rothkopf come out at 4 and talk about the generational damage that has been done to government institutions. But David just messaged and said, man, I'm busy. Can we do it next week? So it was going to be 6 Substack Lives. I'm at 4. And at 5 p.m., it'll be my 5th. And I think I'll call it a day. But this has been Dr. MarkAlain Déry. Mark, as I shamelessly promote you, in the comments section, people are asking for a website or how they can contact you. Uh,
Yeah, I mean, in terms of contacting me directly, either through Substack or through Blue Sky, and again at the Dr. Derry, that's the Dr. Dr. And then my last name Dery. You can find me there and at Blue Sky. If you have questions, I will answer everybody's question. I will go through the comments as well. If you have questions in the comments, I will answer all of those questions as well. I have a website where I have a lot of animations that we've made during COVID called, which is
those are great.
noisefiltershow.com. The website went down for a hot second and we're trying to figure out how to get it back up. It's one of those things where it got started by an old intern of mine and now the email is lost and we're trying to figure out how to get there, but check out our cartoons, Noise Filter. I'm putting up content for This Space, which is a YouTube collective of progressive content creators, and I'm putting up videos all the time. You're going to start seeing those videos. They're like 3 to 5 minute. They're short form videos on topical public health and infectious diseases. You'll see them on Blue Sky. You'll see them here on Substack as well. And yeah, Waj, it's been great, and thank you so much. I appreciate the
Do me a
opportunity.
favor. Do me a favor. Right now, you see that right message at the bottom? Just
Yeah.
type in your Blue Sky. Just type it in right now.
Okay.
And
All
I'll
right.
speak to keep the folks distracted as they see a giant close up of your face. Just type
Sorry.
in those 2 things that you just meant. Um, For those who are watching us at the 1,000 people, we're going to have this conversation up later today. It's a very important conversation about how RFK Jr. and MAGA are ushering in a viral collapse, literally a viral collapse, and how they're going to make diseases great again. It's a five-alarm fire. The comet's coming. Our job is to warn you and then take steps to, inshallah, protect as many people as we can and or blow the comet out of the sky. You have to take this stuff literally, folks. Everything that we warn about, it's the world's worst, I told you. So I get no joy from this. I had so many otherwise informed people. I'm sure they said the same shit to you. This won't happen here. This can't happen here. Trump won't be that bad. The guardrails will hold. People will keep it in check. And like, Mehdi won't mind this because me and Mehdi sit there. I know Mehdi. He's a friend of mine, also non-professionally. We just sat there. We were just banging our head against the wall. And there was a comment that someone made that Americans are suffering from a failure of imagination. Well, you don't have to imagine it, folks. It's happening right now. So I hope MarkAlain, he's really a superstar, especially in the New Orleans community with those progressive communities, just doing amazing work. The man doesn't sleep, throws great parties also. So if you're in Louisiana, be sure to check him out. Also dresses really cool all the time. His wife is cooler, but he's also
100%. She's a lot cooler. And I'm sure it's the same at your household too,
oh yeah,
Waj.
yeah.
You
Oh yeah.
know, I know
I
you're a
married
good
way
guy,
up.
but I could imagine your wife is much cooler.
My wife is smarter, she's prettier, she makes more money, she's better educated. Everybody asks why. They literally
Yeah.
ask her, they look at her, they look at me in front of my face, and they say, why? I'm like, bro, I'm
Yeah.
right here.
Well,
I'm right
does
here.
does your does your mother-in-law do like my mother-in-law does, where she reminds me every time she sees me that I married up?
Yes. Oh, my mother-in-law says, who loves her daughter, she goes, you will not find better. And then my dad, I'm an only child. Check this out. This is how brutal it is. Man, you're Arab, I'm Pakistani, freaking immigrant parents are brutal. I'm an only child, and my dad and my mother say, don't mess this up. You won't get it better. And I'm like, what about me? He goes, you're okay. She's amazing. And so I'm
Yeah.
like, all right.
So Waj is referring to I'm Moroccan. My family's from Morocco. I'm a first generation American, so immigrant parents. And yes, my Moroccan parents, my Moroccan father specifically says the same thing as well. He's like, don't mess this one up. You've got a good one on your hands.
Yeah, yeah, they're a great partnership and they're doing fantastic work. Folks, this has been The Left Hook. There's no paywalls, everything's free. If you can, if you have some money, actually, if you have some money, Dr. MarkAlain, what is a good health organization that is actually saving people's lives that people should donate to?
Uh, right now, I think that the organizations that are going into Gaza, I think are the most important organizations to be
Absolutely.
giving. So I think that you caught me right off the top of my head. I know that I've actually been in touch with a couple of them. There's the one for children. There's I think
PCRF, PCRF,
there,
Palestinian
yes.
Children Relief Fund.
Yes, that one is incredibly important. I've been in touch with them. I've been emailing them. There's a couple other organizations that I'm sorry, Wash, off the top of my head, I can't. My mind is not there. But I think if you do have any monies, I think right now, I mean, what we're seeing here in the U.S. is going to be bad, but what is happening right now in Gaza is just unthinkable. The horrors that are happening, and talk about generational damage. We haven't even gotten into that. I mean, maybe that's another conversation, Waj, is the genetic, the what we are seeing with one of the fascinating things that we are seeing right now is that trauma, and especially the type of trauma that the Gazan, the poor, the unbelievable pain and suffering that people in Gaza are experiencing right now, that is going to be generational. Like,
Yep.
and we are going to see their children and their children's children have some ramifications that we don't even know what that is right now. And that to me is just, we can do things about the pain that people are experiencing right now. We have the tools to alleviate pain, to alleviate hunger. We have those tools, and it's just these people who are above us that prevent us from being able to do something like that. Gaza's a whole other thing, and but
Well,
yes,
no,
if you do,
I'll bring you back to talk about that. But folks, that's the thing. All of this was preventable. All of this, we're still the wealthiest, most powerful country in the world. And I'll end on this because you have, this is how I think. Things are bad. I've traveled the world. Dr. MarkAlain has traveled the world. We're very lucky. My wife has traveled the world. Things are bad in America, but no matter how bad they are, we still are the wealthiest, most powerful country in the world, and we still have a chance. There's still a chance to get better. Uh, in Gaza right now, there's a genocide. These Palestinian kids are suffering from a phase 5 starvation. So take those moments when you can, and I know things are bleak, to just be grateful for what you have, to be aware, and to use your privilege and your resources to bring it back full circle, because Dr. MarkAlain used the word, to do what you can to help uplift others. Because right now you're on the top, but just could happen, folks. 5, 10 years from now, you'll be at the bottom, right? And this is how it works. This is how societies work. This is how families work. This is how relationships work, through reciprocity. I disagree with Elon Musk, who said empathy is a weakness. No, empathy, what it's all about, being selfless, being generous, and be selfish, because you helping people right now, they'll come back and help you. And Americans will need help, folks. Americans will need help with what the Trump administration has done, the generational damage it has done. Dr. MarkAlain Déry is an infectious disease expert, a physician. He has traveled the world. He has helped vulnerable populations. This is his bread and butter. He knows it through and through. For the people who have tuned in, the nearly 1,100 people, this will be up on my Substack and his Substack, and so many people enjoyed having him on. I hope he accepts my invite and we come back and we talk regularly.
Will do. Thank you, Wajir. Just two quick questions that came up. Do I speak in New Orleans? Yes. And then also the radio station is 102.3 WHIV. The website there is WHIVFM.org. And the info email that you find there will go directly to me. So if you do have any questions, you can find me at info@WHIVFM.org. So again, the website is WHIVFM.org. That connects to me. That's our human rights and social justice radio station that I founded with my wife and myself. And I do speak around New Orleans, and you can find me through WHIV. Waj, thank you so much. I really appreciate it.
No, man, thank you so much for taking the time. And I'll be back at 5 p.m. with Stuart Stevens on how Democrats can actually fight back if they had balls and a spine. And it's up to us to put pressure on Democrats, because they're the only political party, folks, that are amenable to change. And that's why I'm so harsh on Democrats. That's why, folks. There's no both sides. I get it. But you have to get the fighters. And if the fighters are unwilling to fight, replace them with better fighters. Folks, this is The Left Hook. Please subscribe. Subscribe to Dr. Déry's Substack. I'll link to everything. It'll be up on our Substacks in about 30 minutes. Be kind, be empathetic. Don't be a fascist. Get yourself vaccinated. Get your immunosuppressed members in your family vaccinated, your elders, your children, and I'll see you back at 5 p.m. Say hi to your wife from me,
Peace
the
out.
better half.
Same. Will do.
Later.
Bye-bye.